Good morning, and hope everyone will have a great day. Um, from Italy, people over 80 will be left to die as countries overwhelmed by the coronavirus. Now, before we get started on this article, I will ask again that you please subscribe to my channel, hit the like button, comment down below if you like what I'm doing, and share the video with people you think will like it. Now, on to the story. This is from the Telegraph. Italians over 80 will be left to die as country overwhelmed by coronavirus. Hardest region, hardest hit region drafts new proposals saying live, who will live and who will die. Socialized medicine for you, and this is why it should not come to the United States. Coronavirus victims, coronavirus victims in Italy will be denied access to intensive care if they are 80 or older or in poor health should pressure on beds increase. A document prepared by a crisis management unit in Turin proposed. Some patients denied intensive care will in effect be left to die, doctors fear. The unit has drawn up a protocol seen by the Telegraph that will determine which patient receive treatment in intensive care and which do not if there's not enough beds. Intensive care capacity is running short in Italy as the virus continues to spread. The document produced by the Civil Protection Department of the Piedmont region, one of the hardest hit, says the criteria for access to intensive therapy in case of emergencies must include age less than 80 or score on a Charlson comor- comorbidity index, which indicates how many other medical conditions a patient has, of less than 5. The ability of a patient to recover from the, the disease will also be considered. One doctor says who lives and who dies is decided by age and by the patient's health condition. This is how it is in war. And then they also have a list of the countries with the most. China at the most with 81,000, Italy with almost 28,000, Iran with 16,000, Spain with 11,000, South Korea with 8,000, United States is at 4,000. France, uh, and then it goes with the deaths. It goes China with 3,200, Italy with 2,100, Iran almost almost 1,000, Spain with almost 500, and France with 150. The document says the growth of the current academic. In case you guys want to see, there's the document they listed. If you guys want to pause it and read it, the document says the growth of the current epidemic makes it likely that a point of imbalance between clinical needs of the patient with COVID and the affected ability of intensive resources will be reached. No, that's because you guys have socialized medicine and you don't, and it's not profit driven, so hospitals will not make enough beds so they can make money off it. So to become impossible to provide all patients with intensive care service, we already read that. Italy has 5,090 intensive care beds, which for the moment exceeds the number of patients who need them. It is also working to create new bed capacity in private clinics, nursing homes, and even intense. However, the country also needs doctors and nurses. The government wants to hire them and buy the equipment. This is, uh, I doubt that could go here because people will, United States love to sue for one thing. You deny a bed because you're too old, someone's going to sue. You buy, you deny a bed because, oh, you don't score low enough on a certain scale, that hospital's going to be sued. This is, uh, China probably already did that way a long time ago and still doing it. They have, what, a billion people to let die. So, as always, everyone be safe. Have a good day. Bye bye.